On today's World Insight, the race to develop a coronavirus vaccine. A Chinese doctor tells us how far we have to go. Then, a cruise vacation turned virus hotspot. A Japanese doctor discusses how the Diamond Princess will conduct an orderly evacuation. And finally, renowned virus hunter Dr. Walter Lipkin describes the prognosis of the coronavirus spread. And here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei. The program is coming to you live from Beijing. We start with the latest on the coronavirus outbreak, officially known now as COVID-19. The total number of confirmed cases in China has surpassed 70,000. The death toll now reached over 1,700, while over 11,000 people have recovered. Here are the latest developments on the virus.
The majority of confirmed cases in China are in the Hubei province. In fact, 70% are in the provincial capital, Wuhan, where the outbreak began. On Monday, newly confirmed cases outside Hubei were down 90% compared to their peak on February 3rd. A hospital in Wuhan has completed autopsies on the bodies of 2 patients who died of the virus. Medical researchers are now reviewing the pathogen reports. Chinese health authorities say the country has taken effective measures to contain the outbreak of the virus.
Though the disease is new, it is preventable and curable. The daily new cases outside Hubei have dropped for consecutive 13 days. These signal that the measures we took are very effective. I believe we will summarize a set of strategies and methods to increase the recovery rate. Not only China, but also the international community can take advantage of those experiences.
Meanwhile, in China, more businesses have reopened. A freight train has left Zhengzhou for Central Asia, marking the resumption of the China-Europe freight trains in the city.
And clinicians. New vaccines. And now I'm joined by Professor Zhang Linqi from the Department of the Basic and Medical Sciences from the School of Medicine with Tsinghua University. Professor Zhang, thank you so much for sharing your precious time out of your very, very busy schedule recently. How are you supporting the front line? And meanwhile, how are you doing your research regarding the antibody and vaccines?
Over the last several years, my group and then Dr. Wang's and Xiang's group at Tsinghua University, we have been focused our research activity to understand how viruses get into cells. By understanding that processes, we could develop a good drugs and antibodies and vaccines to stop that process. So based on our understanding of this process, we are now using the genetic and recombination technologies to develop several vaccine strategies. Hopefully, by using those strategies and immunize individuals, we are able to induce the antibody responses, able to stop the viral infection. So that's actually the prime purpose of our current research on campus. On the other hand, during these processes, we also developed a crucial immunological testing that help the frontline physicians to evaluate the plasma and the blood immune reactivity, so they could use as a surrogate marker to evaluate the potential effectiveness of the plasma infusion studies to treat most severe patients at frontline.
Talking about plasma, this is the key word recently in terms of therapeutic treatment. Now, that process has been used in many cases earlier in treating different kinds of diseases. But whether do we know or not, this is likely to work. According to the latest situation, we have 11 so-called successful cases within 24 hours. But is that big enough to support this argument?
This is a very important area of investigation. For this particular coronavirus, we are not certain whether or to what extent is effective. So that's require a systematic and comprehensive research. That's why we are providing the support to evaluate the immune status of that plasma, try to correlate that with the effectiveness of treatment. In fact, this concept of using plasma to treat infectious diseases back to almost 100 years ago.
Yes.
And when the German scientist Emil von Behring developed the antiserum of plasma against diphtheria. So he actually the first winner of Nobel Prize in medicine and then in medicine, but because of his idea and concept developed of equivalent plasma treatment for infectious diseases. In fact, during the outbreak of many other viral infections, including Ebola and then highly pathogenic influenza, some anecdotal experiment has been conducted in human, but the size and also the conclusion have not been reached.
Yeah.
So given the size of the severe infected patients now in China, we have this unique and then good opportunity to address that in the most scientific manner. So we could reach a firm conclusion based on those important studies.
Professor Zhang, now we understand more than 10,000 people, according to the latest information, recovered. But the question really is, what is the ratio, Professor? There's a crucial issue like this about, how much plasma being used can be for the treatment of how many patients, or vice versa. Do we know? Is there any statistics that we have collected, whether this is going to be resource effective?
This is a really great question, because if we depend on those natural resources, we're going to be very limited. But at present, given what we have practiced over the years, for a donor, if you are a convalescent recovered patient, you are encouraged to donate plasma or blood for treatment of severe patients. For each one donation, someone could donate several hundreds of mils, and then you could use that, and then after certain treatments, and then of this plasma samples to remove some potential harmful materials and to activate viruses. Those samples can be infused directly into patients, maybe with ranging from 200 to more mils. But as I said, those dependent on the natural resources of convalescent patients are quite limited. That's why in our research field, we have been collaborating with partners in Beijing, in Shenzhen, and in many other places, try to isolate those antibodies from the recovered patients so we could use molecular clone method and also production facility to manufacture kilograms, even tons of those antibodies that will overcome the shortness of convalescent serum from patients.
There's another thing regarding plasma, because we had earlier public health emergencies or accidents when people donate their blood and they have the plasma separated from the blood cells, and eventually they have the once again the rest of the blood coming back to their body. Just is going to help those who have donated the blood, but eventually it became a public health accident. We remember that very well concerning the AIDS patients years ago. So Professor Zhang, at this critical moment, everybody is rushing for solutions. How important it is that we take care of different sides of the same issue.
Those are really good points. When the emergency happens, we tend to be overly act, and then during this rushness, we may make some mistakes. But we have to be very, very vigilant about safety first. Safety, safety, safety. Once we have collected the convalescent serum or plasma from those patients, those plasma will have to be treated properly according to the protocol that has been used in the field for years. So safety precaution is a must. So given what we have been conducting and knowing all these years, the safety procedure have already been in place. And I am sure that many of the hospitals and physicians that are conducting those trials put the safety first on top of the list.
But you know, as you may know, COVID-19 is a very infectious disease. We have seen it's easily be infectious from one to the other. So medical workers at different departments of a hospital have to protect themselves because they also need to protect their patients, because once they are infected, they're going to spread it to the others too. So how to keep that balance? On the one hand, you want to make sure there's medical support to the people with long-term disease, but on the other hand, you want to make sure all the medical workers as well as patients seeking treatment in the hospitals can be safe. This is quite a dilemma.
Absolutely. I think at this emergency cases, in particular, we are not understanding, or we don't understand fully how this virus transmits so viciously. So everybody has to be in precaution to prevent themselves and to prevent from their patients to be infected. This is entirely new viruses to us, and we don't know how it is infected. So it is better for all of us to be on guard and to be fully cautious and protect themselves, and then to minimize the chance of transmission. Certainly, it is an added burden to everyone,
I see.
In particular in the hospital setting.
We know, Professor Zhang, that the WHO expert team is now in China, not only including those coming from WHO headquarters, but also those from different parts of the world, from different countries. If you were on that team as a medical worker or as a health expert, what do you think are some of the priorities the team should focus on?
I think if I were on the team, I would really look at the public health measure that China has put into place, and also how effective that measure in containing the epidemic. So that's the first priority. The second priority was to see how the Chinese physicians and healthcare providers has been providing those medical care to those unfortunately infected, how effective that is, and then so they could learn a lesson from the Chinese experiences. Third, I would look at the research activity and also the Chinese experience, how much of those will be applicable to the international community. So we could providing better walls and prevention measures to stop this virus to spread into other countries. In fact, last week in Geneva, WHO held this research roadmap for this disease, including many areas, but basically boiled down to how much we know about this virus transmission, what are the diagnostic treatment experience that China has gained, which could be useful and then applicable to the outside China, and the development effective vaccines, and as well as improve the communication skills, because there's so many informations bombarded to the society. People don't know which ones are correct or which are simply rumors.
Yeah.
And then lastly, they encourage to study on the societal impact by the virus on the society, on the mental health, on our living behaviors. So all those things come together would be the WHO's team to look at. I'm sure many of the achievements that we made will be applicable to the international community.
Professor Zhang, my last question for you. Now, if you look at the numbers, confirmed cases are still up, even though the growth rate has been slowing down. Meanwhile, you have about 10,000 recovered already from the very beginning of the outbreak until now. What is the current stage, if you can share with us your insights and predictions about the overall outbreak? And also, what does this mean when China, which is becoming the epicenter, if we think about the world, the epicenter of the world of this outbreak, what about the other places? Is this going to continue to the other places now? Professor Zhang, what's your assessment?
I mean, prediction for infectious disease is always very, very difficult. Although there's a lot of model floating around, giving the numbers that really try to predict situations. So it is hard to start with, but it is good to know that the rate of increase has been slowed down a little bit. But I wouldn't be too complacent about it, because given the number of the infected people in Wuhan, that's the epicenter of this epidemic, and given the number of severe cases, in particular, given the new hospitals have been built, and a lot of people need to be transferred, the logistic difficulties combined, we still have a long way to go before we see the turning point of this epidemic. So we have to be fully prepared and fully vigilant and fully work as hard as we could to contain this disease. So there will be quite a while before we see the deflection point of this epidemic.
So the light at the end of the tunnel is still a bit far. Is that what you're trying to say, Professor?
Yes, we are confident we will win this war against the virus, but we have to be well prepared before we get there. And then I think combining these tougher measures in terms of quarantine, isolation to break down the viral transmission route, and also boost up the medical care services to those severely affected, in particular by gearing up the research on the vaccine treatments and drugs that will eventually put this virus into its own place. So hopefully this will come sooner than later.
Professor Zhang Wenqi, thank you so much for joining us. I learned a lot. All the best to you and your team.
Thank you.
Looking forward to that result.
Thank you very much.
And you're watching World Insight with me, Tian Wei. Still to come on our program. A cruise vacation turns into virus hotspot. A Japanese doctor describes how the Diamond Princess will conduct an orderly evacuation beginning on this and clinicians.
New vaccines.
Welcome back. This is World Insight. I'm Tian Wei. The coronavirus has spread to 25 other countries. The Philippines, Japan, and France have each reported one death. Now, many more aboard a cruise ship in Japan have confirmed to have been infected, pushing the confirmed cases in Japan the largest number outside China. The Japanese government is strengthening the screening and treatment capacity in case of an emergency. On Sunday, some 400 American passengers were evacuated from the cruise ship. Japanese Prime Minister Shinzo Abe says the rest of the quarantined passengers will be able to leave the ship after the final health check this week. For more on the new coronavirus outbreak in Japan, particularly on that cruise ship, I'm joined in Tokyo by Kojiwada, Professor of Faculty of Medicine at the International University of Health and Welfare. Over the past weeks, Professor Wada had been on board that cruise ship and been talking to the patients on it. So thank you so much, Professor, for joining us. Tell me how the situation has been evolving and whether effective this quarantine has been, not only for people who are not on board, but also for people who have been on board, because we've seen the cases have been ever rising since the quarantine begins. How should we understand it?
Obviously, there were an outbreak in the cruise ship, unfortunately. But I think that everybody on board were really calm, and they are not so many people. Not so many people get panic, and they are still gentle, and they respond to us very diligently, so that we, like supporters, have not so much difficulties in communicating with the passengers. As long as I understand, almost all the people who are going to disembark on 19th with the negative result are going to be able to back to their home. No more quarantined. But maybe there may be some arguments. If for the Japanese people, public health centers, everywhere in Japan may contact those passengers if they are still okay or they are getting sick. So that kind of additional things may be considered.
So they will be home quarantined, or they can just go home and do whatever they want?
Basically, as long as I understand, no like a home quarantine will be enforced for all the passengers. But of course, maybe we may have some kind of support for those who are going to disembark.
Professor Wada.
Some people are really worrying about their symptoms, also the infectivity. So maybe they may have lots of questions. So the public health center can support for those people.
Was there one or two conversations you had with the passengers on board, whether they are being affected or not infected, been talking to you? Do you still remember one of those conversations?
I talked about the symptoms they have, and I heard that many patients say my fever gets like up and down. So yesterday high fever, but the another day going to be below the 37.5, but another day going to up. And also many people have a complaint about no appetite. So they don't want to eat a meal. They don't want to have they don't want to have meal. So they want to have the fresh fruits. So the cruise ship also offered fruits for the passengers.
How prepared are the local communities, Professor Wada, in Japan? Because we're talking about disembarking of a few hundreds of people off the ship, and they are likely without symptom going on with their life. So how prepared are the local communities for that, whether it's about medical supply, whether it's about treatment, whether it's about quarantine, whether it's about the basic knowledge of protecting themselves? Professor.
Yes, the most important thing for the passengers, not to be like to be looked at from the certain prejudice, like a kind of discrimination or not to want to talk to meet or something. So we really need to be careful, not happen such a discrimination or like human dignity issues. But yes, of course, the passengers on board may understand very well about the infectivity of the virus, and also they may scare very much. So I do not worry about they may spread the virus to the others, because they have already learned a lot of things, how to control the disease in the ship. So, but the point is, maybe we have several cases in Japan already in the community. So everybody should have very good precautions. And the Japanese government has just declared we are now the phase of the epidemic initiation of epidemic period. But still, it's not the epic curve is not really peaked. But it's the most important time to control this disease. Yeah. So now the government and also the media encourage people to have very good hygiene practices, like hand washing or some other things, so that maybe we may control the coronavirus in Japan.
Yeah. Japan is to host the Summer Olympic Games. Now, I know the Japanese people have been preparing for this for years. It's going to be a big event and a great event according to the plan. But now we have some difficulties, as you may know, as a result of public health crisis. So how
Yes.
do you, from a health expert's perspective, look at this? I mean, on the one hand, you need to still prepare, make sure there's no plan B. It's going to be on the schedule. On the other hand, there is, in reality, a public health crisis, as you said, initiation stage going on right there.
Yes, we are going to have the Olympics, and now that it's a very important period. But I have a very positive mind, because we have this outbreak before the 5-6 months before the Olympics. So we have certain time to discuss how we can conduct the Olympics safely. So of course now that we are going to face the early phase of the epidemic period, but once we may control this period, but this is also very optimistic. But you know, the coronavirus is a part of the virus which can cause cold symptoms, and those coronavirus easily spread during the winter time, like this, like the Chinese, the spread in China in the really winter time. But hopefully, after the weather gets warmer, and in May or July it's going to be hot, so that hopefully the virus peak can be down. And of course, there may be maybe the southern hemisphere, they are going to be the winter time, and it can be spread possibly. But we hope we may have lots of things we can do to have the Olympics in the same period, and everybody may want to come to the Olympics in Tokyo as well.
Yeah, and another thing is about, you know, Japan been helping China, whether it's from the civil society or is it from a government's perspective, businesses as well, supporting China with medical supply, with face masks, with PPE clothes, you know, wear by the medical workers. So here in China, people are very grateful about what Japan has been doing over the past few weeks. Tell me about, from a health expert's perspective, how do you see this momentum going on in Japan about helping China out of this rather public health crisis?
Yes. Yes, we are very proud of the having the very good relationship with China. And I know that there are so many people have sent the face mask or some other alcohol sanitizer to China. And of course, we are also suffering from the shortage of the face mask and also this hand sanitization. But in Japan, we also are trying to produce those products by themselves. And we are trying to disseminate to the older people who wants to have.
Professor Wada, final words from you. Anything as a health expert and as someone who are talking to our international audience, also including Chinese audience, anything to share?
Maybe two things. One is for the international cruise ship. So there were some other cruise ships who have had a difficult time during this period, and we do not have the clear rule for how we can handle these issues. So the shipping cruise industry and also the international regulation should be discussed for controlling this situation in the future.
I see.
Another thing is we have learned a lot from China, especially for the controlling the disease. And I also heard that many healthcare workers have been infected, and I'm really sorry to hear that. And but that also gives us very good lessons for us. So the infectivity is very strong comparing with other diseases recently we faced. So we Japanese healthcare workers are also trying to have very good precautions and not to be infected themselves. And I hope the Chinese healthcare workers are going to be well, and also controlling this disease. And we also want to have the good communication and good relationship with China.
Professor Kojiwada, Professor of Faculty of Medicine at the International University of Health and welfare. Thank you so much for sharing your experiences with the cruise ship and also the latest cases in Japan. All the best to your people. Thank you, sir.
Thank you.
Thank you very much. You're watching World Insight with me, Tian Wei. Still to come on our program, the renowned virus hunter, Dr. Walter Lipkin, describes the prognosis of the coronavirus spread right after the break. Welcome back. This is World Insight. I'm Tian Wei. With this new type of coronavirus, COVID-19, raging for over a month, people keep wondering whether the outbreak will peak soon, whether that is the right question to ask even. Can we determine the ultimate source of the virus? Is there a cure in sight yet? With these questions in mind, I also talked to earlier Walter Lipkin, John Snow Professor of Epidemiology at the Mailman School of Public Health of Columbia University. Professor Lipkin is one of the world's leading virus hunters. Recently, he came to China at the invitation of the Chinese authorities and had been meeting with Professor Zhong Nanshan to help in efforts against the novel coronavirus. So what does he prescribe? Let's listen in. SARS outbreak, MERS, together with some of the others, have all been related to coronavirus. Of course, there are different types of coronavirus as we speak. Are we seeing an increasing speed of various kinds of coronavirus becoming the source of pandemic in our world today? Is that a concern to you?
If you had asked me 20 years ago, or most scientists.
I wish I could have the opportunity.
20 years ago, would the next virus that was a pandemic risk be a coronavirus? I would not have said yes. I would have predicted it was another virus. So we were surprised by SARS. We were surprised by MERS. We're not surprised by this because we thought there was a possibility that SARS or related virus would come back. The thing that's important to realize is that these viruses are very different in the way in which they have caused, disruption of social fabric as well as disease. SARS had a mortality which was much, much higher than this coronavirus, even though the two of them are genetically related. MERS, which is less well genetically related to either SARS or this coronavirus, had an even higher mortality. However, this virus is spreading much more rapidly than MERS and much more rapidly than SARS. So it may ultimately cause, I think it already has possibly, when people begin to do the analysis, there have been more people infected with this virus than were infected with SARS. So when people say, is this a worse virus than this virus, it depends on how you look at it. There's less mortality.
I understand there are latest practice of getting the blood of some of those who have recovered, and therefore to be able to find out more information and also to probably proceed in the way that you talk about the antibody.
So the way you do that, just so you understand the process.
Yes, please.
The first thing you do is you collect the antibodies from people who have recovered. Then you see whether or not these antibodies can neutralize the virus, prevent the virus from entering the cell, prevent the pathology that's associated with the virus getting into the cell. If it meets that first criterion, right, then it makes sense to proceed further. If you have an animal model, you can then test and see whether or not an animal infected with the virus, you can interrupt the disease process, affect the morbidity, affect the mortality. You then say, okay, we have some hints that this is likely to work, and then you can either use the passive immunotherapy, which requires collection of large amounts of plasma with immunoglobulin for people who've recovered from disease, and also proceed during the interim with building libraries of monoclonal antibodies using recombinant DNA technology, which you can then scale up and try to use. These things are very labor intensive and they take time, just like the vaccine development. But it's something that we need to do even if we're so fortunate that the outbreak resolves, but if that happens, we should still proceed, because something like this may recur.
Have something like this been built since SARS?
You mean the technology required to make such things? Yes.
The library that you just mentioned.
Yes. There are libraries that have been produced.
Here or elsewhere?
Well, I'm not as familiar here, but the technology is something that could easily be employed here. It's not secretive. People have been making monoclonal antibodies for decades, and now there are ways in which you can do it more rapidly.
I've been talking to CEPI people, Professor, which is an international organization trying to make vaccines with a concerted effort together. And they've been telling me that it could be possible to use the reference earlier developed related to MERS, related to SARS, in order to make the vaccines related to this disease faster. Now, have you seen evidence that this could be of much reference for what is going on right now, Professor?
So I think that I like the model of CEPI. It's it's an extremely powerful concept, and the people involved with that are first class. So I think that this idea was what I was alluding to, is to use what we know about the previous experiences with these other viruses to make decisions about how to proceed with this one. And I'm optimistic that it may be possible to do this, particularly with newer vaccine technologies. You could extend that same model and say that drugs that have activity against earlier coronaviruses will probably have activity against this one too, because they have a similar strategy for taking over the machinery of the cell and for making more of themselves.
You were, though, infected last time during SARS.
I don't intend to get infected this time.
So you have more experience than most of the people, particularly for the first responders. How better to protect themselves? Professor, your take?
How to protect yourself. Very difficult to know what to do.
I know.
We don't yet know, for example, how long this virus will exist on the surface. But there's some things we do know. Wash your hands frequently. Not with alcohol, but with soap and water. Just simple soap and water is all you really need. Don't touch your face. We make this point in the movie, too, right?
But we touch our face several times, as
yes,
you
we
also
do,
indicated in the movie.
We try not to do that. So instead of this,
we do this.
We do this.
Yes, indeed.
Okay, so we can do things like that. Air kisses for people who like to kiss, that's fine.
To you, sir.
Perfect, that's fine. Okay, then with respect to the face mask, clearly when you're in a very crowded place, this is something which is important.
But in the U.S., we have specific cases suggesting using something called remdesivir to the patient. It could work for the first recovery case. Of course, it's only the first case, and nobody's saying it's a scientific.
I have so many examples where people will tell me with what we call an N of 1 that this worked. Maybe the person would have improved without it, maybe not. That's why you have to have these things which are called control trials, which is where, you set the trial up in such a way that at the end of the process, you have an unequivocal answer. You know what's real and what's not. So I'm hopeful that one of these drugs that people are using will, in fact, prove to be effective and useful and something that can be produced. We just need to see.
I do not want to mention politics. Unfortunately, though, we do not only have a public health crisis going on, we also have a geopolitics crisis going on. So, Professor, are you concerned as a scientist that you are putting so much effort in helping China or the other countries in fighting against this disease? Are you going to be the most welcome person when you go back home?
So I am very concerned globally about xenophobia. I cannot control any of that. I am not a politician. All I can do is try to make bridges between people and provide the very best advice that I have, and to do my research and to try to communicate with the public, which is what we're trying to do here. So, and we have, I have many friends who have been persecuted for various things, whether they're Rohingya or they're black or they're this or they're that. The fact of the matter is it's one human race.
Virus hunter Ian Lipkin. Thank you, Professor. And that's all the time we have for today. If you'd like to see more of our program, you can search for us, World Insight CGTN, into the search engine. Check out our YouTube channel, Twitter, and Facebook accounts. From me, Tian Wei, and everyone on the World Insight team, thanks for watching, and see you next time. Be healthy.